on smallpox, or otherwise known as variola major. So what is smallpox? It's an acute infectious disease that is mainly known for pustules that almost look like chickenpox but are very different. This is a really good image that kind of shows what it used to look like. It's very infectious, it's rampant, and it starts really quickly in the body, and then it can pass on to other people very quickly. Typically starts with fever, your severe malaise, so meaning your body is very run down, back pain and headache. And the telltale sign of this are pink bumps, and then a rash appears, and these bumps become fluid-filled and pus-filled. They're about the size anywhere from a dime to a quarter, depending on the person, much bigger than a zit. And if they fall off, if you're lucky enough to survive that they fall off, you get like a crater-like pockmark. Almost think of the moon with craters in it, but on your body. And it would typically be on your face, your trunk, and your hands. So what organism caused smallpox? It is a virus called variola major. This is a really good infographic that talks about smallpox. I realize you can't read all the little facts about it, but it's a very good infographic from the Prince Henry Hospital Museum. There are multiple types of smallpox. There's ordinary, modified, malignant or flat, hemorrhagic, and the variola without the rash. Hemorrhagic, typically, an interesting fact is people they died from the symptoms of smallpox, not necessarily smallpox. So smallpox would break down your immunity so much so that you wouldn't have any and you would die from it. So hemorrhagic was bleeding to death. So there is variola major, which is smallpox, but there's also variola minor, which is a less severe strain. And variola is Latin for pox or pustule. So this is a distributed organism. So this is a really good image from the CDC that kind of gives you a look under the microscope of what it would look like. So it comes from the Poxviridae pox virus, which you may have heard with like monkeypox, cowpox. They're all kind of under the same family. It's a large double-stranded DNA genome, and it's brick or oval shaped. And again, if you look on the right side, you can kind of see what it looks like. It's from the Poxviridae and the orthopoxviral virus, and it really was originated from camels coming to Africa. This virus has been around for thousands of years, all the way back from the Aztecs to mummies in Egypt to medieval times to the 1980s. So this is it's a brick-shaped viron, so it's a virus outside of the host, but it can't live, it thrives in a host, so a human, animal. They're approximately 200 nanometers in diameter, 250 to 300 nanometers long, 250 nanometers high, about the size of a bacterial spore. This is a really pivotal image. It was two brothers in 1901. They both were exposed to smallpox on the same day, went through the same series. One was given the vaccine, one was not. This is a really good image because the boy on the left, it's a telltale sign that he has smallpox. You can see the pustules, the really hard pox virus that's on his face, on his trunk. And this was transmitted through respiratory droplets. So in inhaling or saliva, direct contact with body fluids. It's close contact over a period of time. It's super contagious. It starts in your mucous membranes, go to your lymph nodes, your spleen, your bone marrow, and then lastly the white blood cells on the surface of your skin. You have a 7 to 10 day incubation period, and you could also spread this not only by touching or respiratory droplets, but contaminated clothing. Unfortunately, people have used this as a biological weapon, thinking smallpox blankets during the French and Indian War. They tried to use it on Native Americans to get them really sick, and it was successful. And also as something in the air, as an aerosol weapon by the Soviet Union. So the predisposition. So one really great thing about smallpox is that it was eradicated in 1980. There are remaining specimens in laboratories in the U.S. and in Russia. currently today, because the routine smallpox vaccination ended in the U.S. in 1972. I actually asked my mom today about her vaccine because she had one because she was born in the 60s. Very cool to look at. There's a limited risk for smallpox exposure right now, except for terrorism, which again is the smallpox infested blankets or aerosol. There's also another factor, could be permafrost, which is the ground frozen for at least 2 years in a row, holding this virus that could be released. The laboratories keep those specimens just in case we were to have another outbreak. Then we'd have a way to vaccinate again because we know the vaccine works. They've looked at mummies thousands of years ago that had smallpox. So super fascinating, but also scary. So these are a really good image of how quickly smallpox goes. The symptoms appear 12 to 19 days. You typically have a fever, significant headache, abnormal pain, and then you begin the really telltale signs. Lesions on the mouth, which are, they move away from the center. The word is centrifugal, and it soars. So it typically starts as a flat spot, like number 3. Then it gets raised if you think of 4 and 5. Then it becomes a blister if you look at the picture 7. And then it's infected. And if you're lucky and you survive and it falls off, you have a deep pitted scar on your face. Think back to that picture of those little boys. Then your fever returns. There was a 30% fatality rate. Otherwise, if you did survive, you had immunity, but you typically had poxmark scabs remaining on the rest of your life. This is a really good image of the typical stages. This can go from day 2 to day 25. It kind of gives you a clear thing, especially if you look at like day 10, how many pustules are on the individual's face. So, diagnosis. Typically, you do a PRC test, polymerase chain reaction, to test the DNA of the virus. You do this in the CDC in a biological lab, and it would be confirmed by the CDC. And you have to use standard contact and airborne precautions. Remember, this is a super contagious virus. You'd wear PPE, disposable gloves and gown, N95 disposable respirator, and eye protection. So it's a respirator, it's not even just a mask, because again, you could inhale this virus. The doctors would typically look at the lesions, your medical history, and do this blood test. And then you would look at the lesions based on the type, size, firmness, and location. This is a really interesting picture. You can take time to read it. This is the thing. Most doctors today haven't seen this virus, because it was eradicated 50 years ago. And typically, our population now has lost immunity because we don't need the vaccine anymore because it's eradicated. But again, think to those labs that keep the samples just in case we were to need them. Okay, so there are multiple prevention methods. There are some antiviral drugs. Some are FDA approved and some are not. People are not currently recommending this vaccine because it's an eradicated disease, so it's not necessary to there's a couple replication competent vaccines and then a ring vaccine. This kind of gives you a site reaction of what would happen. But if you ask your parents, they still have the scar from this vaccine, which is kind of cool. And then it's a really good picture from the World News when it was eradicated in 1980. Some interesting facts. So Queen Elizabeth had smallpox. She survived it, the first Queen Elizabeth in the 1500s, and Abraham Lincoln had it, actually after he delivered the Gettysburg Address, and they both survived it. It was the first disease eliminated through vaccination, and as I said before, mummies from ancient Egypt show evidence of having smallpox. And the person who discovered the vaccine was Edward Jenner, and he developed it in 1769. So we've had this, but then again, think about how long it took to eradicate it, about 200 years. But super interesting, and they both survived it. If you look at pictures of Queen Elizabeth I, I realize there aren't pictures of her, but if you read history books about her or any history about her, it talks about the pockmarks on her face because I think she was a child when she got smallpox. And these are my references. I had a lot of different references. I found this disease very interesting. I kind of want to go back just one more slide so I can explain a little bit more. Sorry. So I wanted to talk about the vaccine, the virus vaccine. So there's the vacina virus vaccine. So it's a lot of these haven't been tested on people now because the vaccine isn't, it's not necessary. It hasn't been used for 50 years. But again, if you look at the primary vaccination sites on those pictures, it's like a 2-prong poke that they poke individuals with. They would get it from someone who had smallpox, a little bit of it, poke it into the person's arm, and then they would become immune. And again, they're keeping those samples on hand in case we were to have a bioterrorist threat of smallpox. There are also antiviral drugs, and I should note the one that starts with the T, tecovirimat, and the B one, brincidofovir. So, okay, these have been not tested on people yet, but they have been tested on diseases that are similar to smallpox, and so that's why they're FDA approved. That's the same with the top one as well, but that one is not FDA approved. They have these ideas in case we were to ever have another outbreak, and some of these vaccines it's on hand just in case we were able to have it, but it gives us a lot of hope that if we were to eradicate this disease, we could eradicate other diseases. And Edward Jenner was the one who developed the ring-like vaccine that people still used. If you look back of pictures in the even like the 1960s, you can see pockmarks, the pockmark scar. But it's cool that we don't need it today. And then some of the sites I used these are all my reference sites. There was a little bit in the textbook, essentially, that smallpox is a infectious disease and how you would report it. But thankfully, we've been really lucky that it's eradicated, so it's not one that you're going to come across, hopefully, in the medical setting or in any setting because it was eradicated. Thank you. I hope you learned a lot from this presentation.